Hey, Dr. Santos here. I want to share with you some ways to help your child with ADHD. Now, what I'm going to do is I have a screen here on this side, so my eyes are going to move from there back and forth here every so often. Let's start with ADHD, attention deficit hyperactive disorder, right? And I know it all too well. ADHD, I think I first found out that maybe I had this thing when I was a kid. I'd sit in class. I wouldn't sit still. I was restless like a rabbit on a chair. I'd get tired if too many decisions needed to be made. Sometimes my book bag did not look the most organized. So those are just a few common signs of ADHD. The other ones I want to share with you is forgetfulness. Maybe you see that in your child, misplacing things. Maybe you see that they're having a hard time organizing or time management. Maybe you notice that they get distracted easily, or they're impulsive. Perhaps their impulsivity leads to not the best choices, and then they tell you they're sorry, right? That's a common sign of ADHD. There could be a lack of motivation. You know they have the skill in them, but they're just showing some sort of decrease in motivation, which can come with ADHD. So then you're looking at where to help, right? And this is the point of this video, giving you some tools, and you're probably a parent concerned about your child. You know, I think, and I'm a parent myself, I think a really good place to start is with bringing in a team around your child. So that means letting your child's teachers know your concerns, letting the principal, the assistant principal, letting their coach, connecting them with a counselor, which is a side note. Over at Santos Counseling, we have counselors specifically trained in ADHD, utilizing play therapy, DBT, CBT. That way they're showing up effectively. So getting back, when looking at your child, one of the first and really effective things that you can do is making sure that they have a team around them that knows they have ADHD, so they're aware on how to support them. This the second one, and maybe you're not familiar with this one. This is called an IEP, Individualized Education Plan. And here's what I want you to think about to keep it really basic. It's a way to give your child the support that they need. So an IEP, right, it says Individualized Education Plan. It's effective in the school system, K through 12. And it's where your child can have an accommodation. Maybe they need to test by themselves because with the ADHD they get distracted easily, or maybe they need to test a little bit longer than some other kids because they're getting distracted, right? They need to focus. So that's just a little gist of what the IEP can be utilized for, and it's something that you can get with your counselor. It's available, just sometimes maybe a lot of parents aren't aware of it or fully aware of the details, nuances. The other area I want you to look at with ADHD is, and this is, I think this is a really neat one. This is the last one that we'll finish off here. But as always, reach out to Santos Counseling. Let us know if you have questions, if you need support. We're here to help. Routines. It is so helpful that when you're aware that your child has symptoms or the diagnosis of ADHD, throw in routines that are like an ocean wave, smooth. Not an ocean wave, like the sound. Right, sound really smooth. And here's what happens when you give your child that has ADHD a routine. They're not going to feel mentally exhausted because you already know part of the symptom of ADHD is difficulty with time management, difficulty with impulsivity, difficulty with sticking to things and finishing them. So give them a routine that's easy to follow. That just brings that brain power down a bit. Power meaning the amount of energy you got to output. The other part with the routine is you want to think about your routine in a way of lowering anxiety, lowering stress. So I'll share an example in case you're stuck here. The routine could be that your child wakes up, and instead of you telling your child, hey, you got to brush your teeth, get ready, and get your book bag ready, your lunch ready. You structure those out. Here's 2 things to do. And then when you get downstairs, here's 2 other things to do. So now it's achievable. It's just a few things at a time. And now let's say they get home from school. The routine could be have a little chill break, that way you let the brain relax, transition into homework time, but we're mindful of where we transition. So have your child transition in a space where there is less clutter, there is less stimulus, meaning noise or light exposure, just somewhere that there's a reduction in triggers that can lead them to being distracted. So, for a lot of families, a common place to do homework is the kitchen. But the kitchen is noisy, a lot's happening in there. So instead, maybe have like a room to the side that's quiet. And instead of having this 2 to 3 hour homework session, which often is not effective when it comes to ADHD, shift it to time segments. It could be jump in there for 20 minutes and then take a 5-minute breather and then jump back in. And you'll start to notice what's helpful by getting to know your child and how their symptoms show up. And again, counseling is a really effective way because you could come in, parent and child, work with a counselor, get the right tools, go home, use them, come back, see how effective they are. And a lot of these tools you can use in the session too. So with a trained professional, you're able to identify, here's what's working, here's what's not. The last one I didn't mention, you're probably interested in, is the medication route. Some individuals do choose that. What we do at Santos Counseling is we look at what direction you would like to go in. We do provide clinical feedback, we provide support and education, but we also look at what are you comfortable doing. And then from there, we support you, whether it's the medication route, by connecting with your medication provider, letting them know what we're doing on our end, what they're doing on their end, so that we're, again, team, right? We're effectively addressing this in a manner that creates success for now, success for tomorrow. Hope you found this video helpful. If you have more questions on ADHD, please reach out to Santos Counseling. Take care. Have a great rest of the day.